webinar series, Afternoon Teach with VFC. Afternoon Teach with VFC is a CDPH program, a new webinar series offered live to all VFC providers. Again, always held at noon for an hour. These free online webinars cover a variety of immunization topics to help you in your daily work. All of the Afternoon Teach webinars are recorded and posted on EasyIZ. If you haven't already, we encourage you to watch our previous Afternoon Teach webinars. We have a couple on how to set up your digital data logger and another on seasonal influenza. They are fantastic. We encourage you to watch those. I am your host, Edgar Ednicott, from the Immunization Branch. Now let me go through a few logical or logistical tips to make sure you are comfortable and prepared to hear today's presentation. Today we are fortunate to have with us a team of VFC experts. And if you are seeing the screen, then you do have the visual part of the webinar all good to go. We just want to put the slide on the screen for those who are running into difficulty with the audio portion. You do have a couple options of hearing the audio. One is through your computer's audio, one by selecting the call using computer from the drop-down menu, and the other is by having us call you by selecting the call me option. You simply type in the phone number, and a couple seconds later, you'll receive a phone call asking you to connect to the call. So go to the next slide. And so just for your reference, that's the getting your submissions, your questions submitted. You are in listen-only mode during the webinar, but you'll still be able to ask questions through the WebEx chat function. Simply click on the chat box, type in your question, and hit send. We'll review your questions and try to respond during the Q&A portion of the webinar or in future communications. Next slide. We don't anticipate any more technical issues today, but just in case, please write down this email address for assistance. And as I mentioned before, today's webinar is being recorded, and we'll post that on easyiz.org sometime within the next week. Next slide. So I'm going to talk about some of the webinar objectives for today. One is to review the purpose of VFC's recertification, review VFC program requirements for 2019, share tips to help your practice complete your VFC recertification on time, discuss what happens after VFC recertification, and then lastly, answer any questions you may have about the recertification process. So we're really fortunate today to have Christina Sapad with us, our Assistant Chief of the Vaccine Management and VFC program today. I do want to welcome her, and she'll go ahead and present to you. Thank you.
Great. Thank you, Edgar. We are excited that all of you can join us today as we help your practice get ready for VFC's 2019 recertification process. So let's start with providing you with an overview of the VFC program and recertification. Next slide. So one of the initial polling questions that we had was to see your knowledge of what is VFC recertification. Next slide.
Oh, it looks like it's happening here. So fantastic. That's actually really great news. So we do have our first polling question. What is VFC recertification? It's multiple choice. So go ahead and choose A, B, C, or D. And I know there wasn't much time, but the correct answer you will see is C. And I'm not sure if the polling results will come up. But the answer is C. So we'll go ahead and move on to the next slide.
So before we go into the details of recertification, let's talk about the VFC program and its impact in California and across the U.S. So the VFC program was created 24 years ago to help provide vaccines to children whose parents or guardians may not otherwise afford or have access to vaccinations. Over the years, the VFC program has been integral in improving the health of California's children, and now we've distributed 10 million doses of vaccines annually to approximately 3,700 active enrolled VFC providers in the state. For California, 60% of the population 18 years of age and under is eligible to receive VFC-supplied vaccines. Next slide. So the impact of the VFC program and vaccines is really far-reaching. Millions of illnesses, thousands of deaths have been avoided, and trillions of dollars saved, as you can see from this infographic. Your participation in the VFC program is an important factor in preventing disease and saving children's lives. Next slide. Now, what is VFC recertification? Annual recertification is a federal requirement to remain enrolled in the VFC program and continue receiving federally funded vaccines. Recertification is an online process typically launched at the end of the calendar year and allows enrolled providers to renew their participation in the VFC program by updating their information, completing online training, updating patient profiles, and signing new requirement agreements with the VFC program. The VFC program will suspend ordering privileges for providers who do not complete the recertification process on time. Next slide. Completing recertification isn't just submitting a form. It is a series of processes that must be completed in order to renew participation in the program. These steps include completing the required EZIZ lessons, review participation summary from the previous year, which is your practice profile, verify provider licenses, update information for vaccine storage and temperature monitoring equipment, review and update your patient estimates for VFC-eligible children to be immunized in the coming year, and also acknowledge and sign updated agreements with the VFC program. Next slide. One of the important aspects of participating in the VFC program is assigning key practice staff who will be responsible for managing the VFC program at your practice. These roles include what you see here, the provider of record and the provider of record designee. Basically, the provider of record is the physician-in-chief or medical director or equivalent role that would sign and agree to the terms of the VFC provider agreement and the provider agreement addendum. The provider of record designee is an on-site person that is designated by the provider of record to sign VFC documents on his or her behalf and assume responsibility for VFC-related matters in the absence of the provider of record. Next slide. In addition to those two key practice staff, we also have the vaccine coordinator, who is the on-site employee fully trained and responsible for implementing and overseeing the provider's vaccine management plan. The backup vaccine coordinator is another on-site employee who is fully trained in the practice's vaccine management activities and fulfills the responsibilities of the vaccine coordinator if the vaccine coordinator is unavailable. Next slide. So some key dates to remember around recertification. Our target launch date will be this Wednesday, December 12th, and we will have recertification due by Monday, January 21st, 2019. Keep in mind that you must complete all the required training lessons before you can access the recertification forms. And in order to continue receiving VFC-supplied vaccines during 2019, each VFC provider account must be on active recertified status. So we will send you a communication once the online recertification form is accessible, so you have more than 30 days to complete the recertification process. Please be sure that you complete recertification on time to prevent suspension of ordering privileges. Next slide. Okay, now on to program requirements. Next slide. So there are several resources that are available that list all the VFC program requirements. The VFC provider agreement outlines federal requirements to receive publicly funded VFC vaccines. And review of this information is really key for the provider of record. The provider of record will be agreeing to meet these requirements. Next slide. The provider agreement addendum contains California-specific requirements that are related to vaccine management, training, storage equipment, vaccine ordering, vaccine administration, and program integrity. So another key document for your provider of record to review. Next slide. So by signing the VFC provider agreement and the provider agreement addendum, the provider of record agrees to follow all VFC requirements for participation in the VFC program, and the provider of record, like I mentioned earlier, would be the medical director or equivalent role that is authorized to administer pediatric vaccines under California law. Providers signing the agreement on behalf of a multi-provider practice must have the authority to sign on behalf of the entire organization, and keep in mind that the provider of record is held accountable to the organization's compliance and site visit requirements and also the educational requirements. Next slide. So I wanted to highlight some of the updates that we've made to the 2019 VFC requirements. So there are several items listed on the provider agreement and the provider agreement addendum, but here are some of the important changes to keep in mind with our VFC program requirements. So all VFC providers agree to administer all ACIP-recommended vaccines, which includes flu vaccine, in-house. Do not refer patients to other facilities where they might be charged for the vaccine administration fee. All VFC providers also agree to ensure that VFC-eligible children have access to non-routine ACIP-recommended vaccines when indicated or when requested. Administer all VFC-supplied vaccines at the approved location for the VFC PIN. Administration of doses outside the approved location, for example, at special event clinics, health fairs, special school clinics, or mass vaccination clinics, is not routinely allowed and requires prior approval from the VFC program. Now, for your non-Medi-Cal VFC-eligible patients, VFC providers agree to waive the administration fee if the parent or guardian is unable to pay. Never bill the parents who are unable to pay the waived administration fees. So those are just a few highlights of our VFC program requirements, but again, the requirements are listed in detail in the provider agreement and the provider agreement addendum. Next slide. We also have a nice document that summarizes these program requirements. It's our 2019 program participation requirements at a glance. So it contains all the items that we have listed in the provider agreement and the provider agreement addendum, with a link to resources and job aids that will help you meet these requirements. So it's a really useful resource that is available on our ECIZ website. Next slide. Another useful resource is our Provider Operations Manual. It's a reference guide that helps providers stay compliant with VFC program requirements. This reference guide provides clear instructions that help providers incorporate VFC program requirements and best practices into their existing practice protocols. So printed copies of the Provider Operations Manual and a VFC binder were mailed to all active VFC providers earlier this year, so please use that as a reference. It's very helpful. Next slide.
So we're off to our second polling question. We may try to make an attempt to this, but if not, we can use this as a teaching moment. So polling question number 2, the provider of record must agree to comply with which document that details California-specific requirements related to vaccine management, training, storage equipment, vaccine ordering, vaccine administration, and program integrity? Is it A, VFC Provider Agreement, B, VFC Provider Agreement Addendum, C, Program Participation Requirements at a Glance, or D, Provider Operations Manual? You have 30 seconds. Great. Well, it looks like a majority answered A, which is the VFC provider agreement, and that is incorrect. The answer is actually B, VFC provider agreement addendum.
Yeah, so the VFC provider agreement addendum contains the California-specific requirements. So the VFC provider agreement are the federal VFC program requirements. So for California-specific requirements, please refer to the addendum. Okay, next slide. Now we'll go over a little bit of the training and IT requirements so that you can complete the EZIZ lessons related to recertification. So every provider must receive comprehensive training upon enrollment and annually thereafter. So all key practice staff are required to fulfill educational requirements annually, and the requirements include covering VFC program requirements outlined in the agreement, and also training on proper vaccine storage and handling. These lessons are available on EZIZ and must be completed before you can recertify each year. Next slide. So there are 4 lessons in addition to a review and acknowledgement of the updated vaccine management plan and the VFC provider operations manual. All key practice staff are required to take the VFC program requirements, storing vaccines, monitoring storage unit temperatures lessons, including the acknowledgement of the provider operations manual and the vaccine management plan. Although the vaccine coordinator and backup vaccine coordinator are required to take the conducting a vaccine inventory lessons, the provider record and the provider record designee are encouraged to take this lesson as well. Next slide. So the provider operations manual acknowledgement lesson will be outlined as one of this year's lessons. Keep a printed copy of your provider operations manual in an easily accessible location to key practice staff and refer to it for easy step-by-step procedures when staff have any questions regarding vaccine-related tasks. And at the end of this acknowledgement lesson, you would click the checkbox so that you can receive credit for 2019. Next lesson. So for the annual educational requirement, you have the option of testing out. If you took the required lessons in the previous year with a passing score and also received a passing score on this year's pre-lesson check, you have the option to skip the lesson, or what we call test out, or you can take it again to refresh your knowledge. Other staff with vaccine management responsibilities beyond the key practice staff that are listed for VFC should also take the EZIZ lessons. Next slide. For your EZIZ training account, please complete all the lessons under one training account per user. Do not use or create multiple training accounts per person. If you happen to forget your username or password, you can contact the VFC call center and they can assist you with that. Also ensure that your training account is linked to your practice's VFC PIN. All key practice staff within the practice must have taken the lesson before the online form can be accessed. Next slide. So when to begin the required trainings? So you can begin the required trainings as soon as recertification is launched, and they are available on eziz.org. Any lessons that are completed prior to the recertification launch date will not receive credit towards 2019 VFC recertification. So do not take the lessons now, wait for recertification to be available, and then you can get credit for 2019. Next slide. So there are certain browsers and versions that can be used to complete the lessons, including Internet Explorer and Firefox. Those have been the ones that have shown to be more compatible with the lessons. So please ensure that your internet browsers are up to date, your browser history is cleared to prevent any issues with accessing the lessons. The lessons will require that Adobe Flash and JavaScript are enabled, so make sure to enable any pop-ups so that any instructions, if prompted, will display. So the system will do a check if you have Adobe Flash or JavaScript enabled. Next slide. So in this slide, you'll see a few of the pop-ups. So you would see this message if you happen to be using Google Chrome. It's currently not recommended for taking the EZIZ lessons, so the browser will prompt you of that next. You'll also see this message if you happen to not have JavaScript turned on, and if you need instructions, you can click on the link on the message, which will give you instructions to enable it. Next. If you do not have Flash Player installed, the lesson will also prompt you as well. Next. And then this is the message that you'll get when you reset the lesson. So you'll have to reset any lessons that were taken previously in order to get credit. So be sure that you click OK to restart the lessons required for recertification. And next. And if you happen to pass the pre-lesson test and you received a passing score previously, your score will qualify you to take the lesson.
Okay, we're on to our third and final polling question of the day. When should you begin taking the EasyIZ lessons required for certification? Is it A, 1 month before recertification launch, B, now, C, once recertification launches, or D, never? I already passed the lesson last year. Now have 20 seconds. We're just waiting for the results. It should be coming in shortly. And it looks like a majority of you got it correct. The answer is C, once recertification launches.
Okay, great. So next slide. Okay, now let's talk about how to prepare for recertification. Next. So we have a recertification worksheet which you could use to gather information needed ahead of time to complete the online VFC recertification form. It contains spaces for information that you will need to review and update for online recertification, which includes your practice information, key practice staff, vaccine storage and temperature monitoring equipment, patient estimates, and additional healthcare providers. So preparing this information now will help you complete the online form in one sitting. Next. Now would also be a good time to gather information for your patient estimates. The VFC will preload estimated number of VFC-eligible children to be immunized during 2019, and this information that we have is based on reported vaccine administration that your practice had submitted during routine orders. So your practice must verify and edit these figures, plus add any private patients based on your actual patients served during 2018. So as a tip, you can run reports now from your electronic health record, your immunization registry, or VFC vaccine usage logs to gather patient population data. Next. Medical licenses, they are verified upon submission, so you can use the BREEZE website from the California Department of Consumer Affairs to verify that you have the correct medical license information for your provider of record, and make sure that you're submitting the correct information on the recertification form. So here's a view of the BREEZE website. Next slide. You will also need your National Provider Identifier, which is a unique 10-digit numeric identifier for healthcare providers. So healthcare organizations and individual healthcare providers will have different NPIs. So if there is more than one NPI, enter the organization NPI on the practice profile step, and enter the NPI for the individual healthcare provider on the key practice staff step. Again, you could look this up ahead of time on the National Plan and Provider Enumeration System website. Next slide. Now is also a good time to ensure that your data logger calibration is up to date. The VFC program requires that all digital data loggers used for temperature monitoring of VFC-supplied vaccines must have a current certificate of calibration. This is also applicable to your practice's backup data loggers. If needed, calibrate your data loggers now prior to recertification launch. Next slide. So plan ahead. If any of your data loggers have an expired certificate of calibration or will be expiring soon, make sure you send it out for calibration services prior to submitting your recertification. Now would also be a good time to ensure that all staff with temperature monitoring responsibilities are trained on the use of your clinic's data loggers. Next. So all key practice staff, like I mentioned earlier, are required to fulfill federal educational requirements. So make sure that you set aside time for your staff to complete it. It will take a couple of hours if they've never completed the lessons before. So put time on your calendar now to ensure that your staff can complete it. Next slide. Now, work with your VFC field representative if you have any issues that may block you from completing recertification. So there are certain providers that will not have access to recertification, and these providers include those that are suspended for mandatory corrective actions, those that have a digital min-max thermometer, especially since we've required for the past year, more than the past year, to have digital data loggers. So anybody with a digital min-max thermometer cannot recertify, and also providers with a household-grade combination refrigerator freezer unit, which does not meet VFC program requirements. Next slide. Now we're on to completing the actual recertification form. So set aside time to complete the recertification form in one sitting. Information will be pre-filled on each page of the form, so it will be a little bit easier. The information that you already have with the VFC program will be on the screen, but you need to make sure that all the information is up to date and make any changes as necessary. Information entered on each page will automatically be saved as you move forward. So you'll see a new Save and Continue button, so that the system is saving the information that you are entering as you move forward through the form. Next slide. You can see the VFC recertification button on your My VFC Vaccines page once recertification is launched. So you would click on that button to begin. Next slide. And then prior to accessing the actual recertification form, you will view your VFC practice profile. And the practice profile contains important information about your participation with the VFC program. The information included here would be your practice volume, your order frequency, as well as the number of VFC vaccine doses distributed to your practice in 2018, along with the number of vaccine doses wasted due to expiration or spoilage. This profile also includes a summary of your vaccine administration and target administration levels based on reported vaccine usage that you had submitted with your VFC vaccine orders. Next slide. At the bottom of the profile page, you will see the information for key practice staff who had completed any lessons. You will see a list of staff members that either completed all the lessons required for the vaccine coordinator or backup vaccine coordinator, or any staff that completed the lessons required for the provider of record and provider of record designee. If you do not see a key practice staff member among the list of accounts, it could mean either that their EasyIZ learning history account is not linked to your VFC PIN, or they did not complete recertification required lessons on EasyIZ. Next. One of the first pages you will see for recertification is the practice profile. Here it will have all the information about your practice, your name, delivery address, NPI number, and your delivery hours. So be sure that the information you see is up to date and correct if necessary. Next slide. The next page is key practice staff page, where you would list your provider of record, vaccine coordinator, backup vaccine coordinator, and the provider of record designee. So information on this page will be pre-filled with any staff member that had completed the required lessons, so please ensure that the correct email address is entered for each key practice staff. Keep in mind that important program information is emailed to all key practice staff but only the vaccine coordinator and backup vaccine coordinator receive emails related to vaccine orders. So if you have staff that are out of the office, it is best to have different email addresses listed to ensure that communications are being routed properly and are read on time. For our providers that are part of our Vaccines for Adults program, they will need to enter their primary VFA contact, which is the person responsible for managing VFA vaccines for your practice. On the vaccine storage equipment page, you will see pre-filled information on any of your vaccine storage units and temperature monitoring equipment. Please include all vaccine storage units that are used to store federally purchased vaccines, which is either VFC or 317 funded vaccines, including those that are located in any mobile clinic. Also ensure that your data logger has up-to-date calibration, and if needed, calibrate your data loggers now prior to recertification launch. Next slide. So for patient population, you would need to enter the estimated number of VFC and non-VFC eligible children to be immunized during 2019 based on actual patient population served by your practice. And you would also need to include any sources of data that you use to formulate your estimates, which could be billing information, care usage reports, electronic health record usage reports, or VFC usage logs. Now, one of the questions that we ask is how many privately insured patients you have 0 through 18 years of age. So please include that number as well. If you mark that you have 0 patients in the privately insured category, that means you are 100% VFC eligible and that all the patients in your practice are eligible for VFC. Now, if you do enter that, you will be required to click on the checkbox acknowledging this for your practice, but also keep in mind that misrepresentation of your patient estimates may lead to activities that can constitute fraud or abuse. So please be sure to enter your estimate correctly. Next slide. So for additional healthcare providers, you would list all healthcare providers with prescription writing privileges who will administer VFC-supplied vaccines. Only include those who possess a medical license or are authorized to write prescriptions on this page. You can also delete any providers that are no longer working for your practice. Next. Then you will see the VFC provider agreement. So the provider of record is expected to review the provider agreement and the provider agreement addendum to certify that they have read and agreed to the VFC program requirements listed and that they understand they are accountable for compliance with these requirements. Next slide. So you will see different agreements in addition to the VFC agreement. So for our 317 providers, which are mainly our local health department clinics, they will see a 317 agreement. Our VFA providers will also see a separate 317 agreement that are tailored towards VFA program requirements. At the end of this page, you will enter the name of the person submitting the application. If this person is different from the provider of record, the information entered in recertification has been saved, and it could be reopened at a later time so that the provider of record can come back and review and certify agreement to the VFC program requirements prior to submission. Next slide. Now, what happens after recertification? Next. So after submitting recertification, an email confirmation will be sent from easyIZ.org, and no reply at easyIZ.org, to the provider of record, the vaccine coordinator, the provider of record designee, and the backup vaccine coordinator. So basically, all key practice staff will receive the email, in addition to the person submitting the reform. Please be sure to check your junk folder if you do not receive an email confirmation right away. Any required follow-up actions will be at the top of the confirmation of the submission page and the confirmation email. At a later time, you can also view what you had submitted for recertification on your My VFC Vaccines homepage, and you will click on the link View Recertification. So it's the same button that we had shown earlier. Instead of saying Submit Recertification, it will say View Recertification. Next slide. Now is also a good time to review and update your vaccine management plan. So the vaccine management plan is required to have staff review on an annual basis. So you could have the staff sign the plan acknowledging that they've reviewed it and are familiar with all the information contained in the document. Next slide. After submitting recertification, you can go to your Update Practice Information link, which is on your My VFC Vaccines homepage, to update any information at a future date. So you could enter changes for your vaccine coordinator, your backup vaccine coordinator, update vaccine storage units or data loggers, patient population estimates, or additional healthcare providers. However, any changes that are made to your provider of record or designee after recertification will require that key practice staff change request form so that the new provider of record can provide a signature authorizing these changes. Plus, they would also need to agree to the VFC provider agreement and the addendum. This form is located on easyIZ.org and can be found by searching for IMM 1166. Now, there are some consequences for not submitting recertification on time. Next slide. So recertification is typically due at least 1 month after we launch it. So not completing it on time will lead to suspension of vaccine ordering privileges and may lead to eventual termination from the VFC program. So it's best that you prepare and gather information for recertification now to ensure that your practice maintains its active status in the VFC program. Next slide. Now, I just want to summarize what we had gone over today for recertification. So some tips: definitely plan ahead and set time. Designate time on your calendar to complete recertification activities. Also check with your IT department to ensure your browsers are up to date and your Adobe Flash Player and JavaScript are enabled so that you can take the lessons smoothly. And also run reports now from your electronic health record, your immunization registry, or your VFC vaccine usage logs to gather patient population data. Also ensure that your data logger calibration certificates are up to date and verify any medical license information for healthcare providers with prescription writing privileges that will be administering vaccines. Next slide. So to summarize some of the steps for successful completion of recertification: plan ahead and set aside time, complete the recertification worksheet, verify medical licenses now, make sure your internet browser is up to date. Once recertification is launched, you can take the lessons, verify data logger calibrations and gather the certificates of calibration, complete the recertification form, review program requirements and the program operations manual, and complete recertification by the deadline of January 21st, 2019. Next slide.
Thank you very much, Christina, for all the helpful information and tips about recertification. Now we're going to enter our Q&A session. We do have 15 minutes left here. We want to end on time. So before today's webinar, we ask that you submit questions for today's Q&A session. Thanks to all that submitted those so far. We also received a number of questions through the chat function, and if we have time, we'll try to get through those as well. So we do have a team of VFC experts with us today. They will be reading off questions and responding, so let me hand it off to the VFC team to address the variety of questions that you have posed up to this point.
Thank you, Edgar. Here's one of the questions that we've received. How long does it take? Well, actually, we find that it'll take approximately an hour. What you have to remember is that before you can do recertification, you must take all of the lessons. In addition to taking the lessons, we're asking that you please make sure that your browsers are up to date. As it was stated earlier, Internet Explorer and Mozilla Firefox we have found to be the most compatible with the easyIZ lessons. So you want to ensure that those, again, are up to date and that your browser history has been cleared to prevent any issues with accessing the lessons. And also remember the lessons require Adobe Flash and JavaScript. So if you have those things already done, that will help the process go smoother. And then the third thing that you want to take into consideration that will help the process go a little bit quicker is there is a recertification worksheet. It is an optional worksheet. It is not something that you would submit, but the information that is on that form is the same information that's on the online recertification document. So if you do all of those things in advance, the process should take approximately 1 hour. Now, if you've not taken the lessons before, you need to set aside time for that. And if you don't have JavaScript or Adobe Flash, you'll need to make sure that that is on your system. So thank you for that question.
Another question from one of our providers is, when will the lessons begin? Like Christina said in her presentation, the lessons will begin and you'll have access to them on the day recertification starts, which is this week on December 12th.
Is recertification the same as an audit? So no, recertification is not the same as an audit. So recertification is essentially re-enrolling in the program and agreeing to the current program requirements.
Thank you, Megan. Another question that came in actually has to do with what are the key changes for VFC program requirements. Excuse me. And thank you for that question. As Christina mentioned, there are a few key changes to the program requirements. We do try to highlight those in the VFC program requirements at a glance, and you can see the new little red icon on those items that have changed in that document. But in a nutshell, we are focusing changes on influenza, making sure that children who are VFC eligible are able to receive vaccines within the medical home. Really also ensuring that VFC eligible children have access to non-routine vaccines, also within medical homes. Vaccinating only at approved sites, meaning if providers are doing outreach clinics, which for the most part these are limited to local health departments. But if a site is doing an outreach clinic, there are requirements that are spelled out that need to be met. Vaccine administration fee is an important requirement and change, making sure that if a child's parent who was not able to pay that administration fee, and that fee was waived at the time of immunizations, that fee remains waived, and the parent does not receive a bill for those fees later. Once again, the VFC program requirements at a glance actually highlights those requirements along with links for job aids and resources to help you meet those requirements, and even links to the program operations manual chapter that has more information or procedures related to that requirement.
Okay, here's another great question. What is the timeline from the time research opens to when it closes? Basically, how much time do we have, and when can we take the online test? So thankfully, we're giving you a head start and giving you information to help you prepare. Recertification is expected to launch December 12th and last through January 21st, giving you just under 6 weeks to complete the recertification process. And again, you can begin taking the Easy IZ lessons once recertification launch on December 12th.
And now we've got a question about the test out option. Specifically, what is the test out option? The test out option allows eligible providers and key practice staff to get credit this year for the lessons they successfully completed or tested out of during the previous year's recertification period. This applies only to lessons where the test out option is available.
So how do I recertify? I have never done this before. Well, first, I'm glad that you joined the webinar. As you've noticed, the recertification consists of actually two different parts. The first part is completing the required trainings. The second part is completing the recertification form. So once you and all of the key practice staff for your site have completed the required Easy IZ trainings, you will log into your My VFC Vaccines account and access the recertification form. The information's been pre-filled, so you'll just review and confirm the information is still correct. If it is not, then you will update that information.
Thank you, Megan. So this question actually is great because a lot of our issues with the recertification that cannot go through our system actually has to do with the verification of a medical license. Thank you, Christina, for sharing the website in which clinic staff can actually go ahead of time and validate medical licenses. And here's the question: why can my medical license be verified with my name? So we recommend that you enter your name as it appears on the medical license. Do not include the middle name, initial name, or any titles such as the MD, DO title, and use the BRIEF website, once again, to validate those licenses ahead of time.
Thank you, Claudia. We've got another question about the test-out option. What lessons will the test-out option be available for? For 2019 recertification, providers have the option to test out of the following lessons: the VFC program requirements, storing vaccines, monitoring storage unit temperatures, and conducting a vaccine inventory. Remember, this applies only to lessons where the test-out option is available for the 4 previous examples that I gave.
And here's another question. I am a new provider that just enrolled in VFC shortly prior to the recertification launch. Do I still need to recertify? Yes. All active VFC providers, regardless of their initial enrollment date, are required to complete recertification in order to agree to comply with the most current VFC provider agreement and VFC provider agreement addendum.
And this question came in via chat, and it has to do with helping the clinic on running patient estimates. What sources of information of data should they be using, since not all of the patients are included in care? And we recommend using a number of sources that you have at your disposal, as Christina mentioned, really validating those estimates, which VFC program has provided based on vaccine administration data, are converted via a difficult formula to children. So we recommend you, if not all your children are in care, and your practice may be using an electronic health record, that is actually a wonderful source of information so that you can run which children are privately insured by age versus which children are VFC eligible. Another possibility, if your clinic is manual and are using paper logs, yes, it will take some time for you to go through monthly logs, but that's also another alternative for you to look at the number of VFC eligible questions. VFC eligible children, sorry.
So why is there only one space for one backup data logger? So while the VFC program requires that minimally you have one backup data logger available, providers with multiple storage units, it's recommended that they have multiple backup data loggers, but minimally you must have one.
Great. Thank you very much. I think that's all the time we have for questions right now. A special thanks to our VFC team for answering the questions. Also, special thanks to our speaker, Christina, for speaking today. This concludes today's webinar. We want to sincerely thank you for joining us today. We understand that it takes a lot of time and effort on your part to prepare and complete the recertification process every single year. So thank you in advance for completing it this year. We do hope today's webinar made it just a little bit easier. But most of all, thank you for keeping California's children healthy, happy, and protected from disease. See you next time for some afternoon teach. Have a wonderful afternoon.